Can I encourage you to come sort of down the front so we're not too dispersed? Excellent, thank you. Very obedient, Rich, thank you. Super. Okay, in the interest of time, I'm going to kick off now. People may well join us during the session, but I'd like us to make a start so that we've got a good time for conversation. So, I am Saffron Caudry, I'm Deputy Chief Executive at NHS Providers, and I'm really delighted to be chairing this important session today, which is going to focus on race discrimination in disciplinary cases. And before we go any further, this will be the first of many plugs for this report, which is, I think, a really, really good practical example of some joint work between Hempsons, one of our partners, and NHS Providers, and really here to help you with your day-to-day. And if you haven't got a report, there are some on the chairs. If they run out, don't think they will, but if they run out, there's some downstairs on the Hempsons stand or on the NHS Providers stand. And I, of course, encourage you to visit both stands. I think it's fair to say that there's never been a more important time to discuss this issue, given the environment we're in, and I'd probably say toxic, hostile in terms of some of the approaches and attitudes to equality, diversity and inclusion, and thinking about how we tackle that. You know, I think it's so important that we shine a light on what we can do really practically to close some of the gaps that exist between people's experience if they have a white skin and people's experience if they are from a different ethnic group. And I think that's never more important than now. We know that there is lots of talk around RES, and we talk a lot about the RES data, and that's very, very important. You have to have a strong evidence base and a strong bank of data to support what you are doing. But I think also we need to think about the broader environment in which we're operating. What's the culture out there? What are we really grappling with? And we're going to explore today also some of those elements around what it means to be operating in the regulatory environment that we're operating in at the moment, because that seems really important alongside a lot of the work that we're doing around RES, looking at the data and finding some really practical measures to tackle that. So, lots of issues to grapple with. I keep saying this, but we want this to be a really practical session. So we want people to ask questions where they come away with some actionable insights. What are you going to take back to base to really do something with? And I think the report goes hand in hand with that. So what can you learn from speakers? What can you learn from each other? I'm now going to introduce our speakers. They will speak for 10 minutes each, and then we will have the wider discussion and Q&A, and we will finish by 3 p.m. sharp. So, first to speak will be Andrew Davison, who is Head of Employment at Hempsons, and he's going to talk us through the background to these issues and the report. And then we will go on to Janine LaRosa, who is Chief People Officer at Barking, Havering and Redbridge NHS University Hospital. I'll get there in the end. And you're going to talk about the wider context and that call for action. So, over to you two. If you get close to time, I will just give you a little nudge.
Fine, nudging's fine. Nudging's good. So just wanted to say a few sort of opening remarks really about the guide. First of all, we're very pleased, of course, to be producing this guide with NHS Providers. One of the things that we discussed at the very beginning was that there's a lot of information out there about the disciplinary gap. Some of it tends to be quite vague and aspirational. So the intention really behind this guide was try and find something a bit more specific. So you'll see in the guide when you have an opportunity to read it that we talk about the background, we talk about the context, the disciplinary gap, and a little bit about the legal context as well, as you'd expect. But fundamentally we're talking about implementable strategies, actionable things that these 4 trusts that are included in the guide have done, the impact those strategies have had, and some lessons to be taken from that. So the focus very much is on actionable things. Because as I say, the thing is that everybody agrees the disciplinary gap is a bad thing and it should be reduced. It's trying to find those actionable strategies. And that's what this guide really is primarily about. But just some context setting and some initial points, really. The gap itself, I mean, for most people you'll understand this, but the gap is the difference in the likelihood of ethnic minority staff entering a disciplinary process compared to their white colleagues. And if you go back to the original starting point for the res data, 2015-2016, the difference was 1.56. So you were 1.56 times more likely to enter a disciplinary process. The latest figure is down to 1.14. It's static. The 2021 and the 21-22 figures is 1.14. But there are still differences. If you look on a regional basis, there are still half the trusts, for example, are on a figure of 1.25. There's still plenty of work to do to close the gap, or at least reduce it significantly. In terms of causes of the gap, we can all speculate. Certainly there are multiple causes, without question. We talk about some of this in the guide. Things, of course, like conscious and unconscious bias, things like lack of cultural awareness, systemic issues, structural issues, and so on, organizational culture issues. All these things are big things to tackle. And if you look at some of the strategies that we set out in the guide, it's on the basis that there are multiple causes, and therefore the strategies are trying to deal with a number of things to try and bring the disciplinary gap down. It's not a problem that's unique to NHS employers. The GMC, the NMC, other regulators have highlighted the issue in their own field, in the regulatory field, that there is a corresponding gap. And again, there's an aspiration to reduce that in both GMC and NMC quarters. The consequences of the disciplinary gap are significant and long-standing on trusts. There's the obvious consequence, which of course this is discriminatory and unfair. On top of that, you've got issues about staff well-being. We emphasise the well-being of staff, but clearly the disciplinary gap indicates that there is more work to be done on it. The issue about retention, keeping the right people, keeping a diverse workforce, increasing the diversity of workforce. All of these things are consequences, unfortunately, of the disciplinary gap if it's not tackled. There is clearly a link between patient safety, patient satisfaction, and these issues as well. So all of these are consequences if the disciplinary gap's not reduced. And the other point is really in relation to reputation, and that's in a way where lawyers come in. Because certainly it's true that in recent times there have been a number of recent cases that have been high profile and also very expensive for the NHS employers involved. And from our perspective as an organisation that largely defends NHS organisations, we think about the way a tribunal will view these issues in the context of the disciplinary gap. And in short, the way tribunals look at this is they look to the employer to have a solid and reasonable explanation for the actions they're taking. And if you put somebody into a disciplinary process and you take them all the way through, you're going to have a solid reason for doing that, because otherwise tribunal can infer, and they often do, discrimination in these cases. Tribunals are not looking for the smoking gun. They're not looking for clear and incontrovertible proof of discrimination. They're looking in many cases, and the leading cases show this, they're looking for a lack of an explanation, a lack of a consistent explanation from the employer. So when it comes to putting people through these processes, you're going to have a solid basis. Looking at the case studies themselves, because those are the more interesting part of all of this, if you read the case studies, you look at the strategies that are being implemented, there are some really interesting differences between approaches. There's some consistencies as well. Just picking out a few things, for example, Yorkshire Ambulance Service have what they call a gateway approach, which is very sensible, which is to look at disciplinary issues before you enter a process, have an objective view of what the concerns are, in an attempt to make sure that when a case does go forward, it goes forward on solid grounds. And other trusts have that. I know other employers have that in place or similar. Black Country Healthcare have cultural ambassadors, which is very interesting, and that seems to be fairly innovative. It's a joint effort with the RCN, and the idea is you have a neutral observer in disciplinary procedures to see if there are any potential issues that need to be picked up in terms of potential discrimination. Pennine Care talked about freeing up capacity for senior HR people so that they could spend more time on the oversight of cases, making sure again that the right cases go forward and cases where there is no case to answer don't proceed. I won't say anything about barking because Janine's here, so she can talk about barking in a bit more detail. But all 4 of those case studies show different approaches. But there are some commonalities as well. So if you look at things like education and training, clearly that's an important aspect in different respects. Restorative and just culture, we saw several references to that when we had our discussions with the 4 trusts concerned. Looking at policies, looking at structures, looking at ways in which the system works before you get to the point of a disciplinary process. And then finally, monitoring and board buy-in and leadership, absolutely crucial to all of this. Looking at the figures, making sure you're monitoring the right thing and keeping on top of it. This isn't a once-in-a-lifetime thing you do. It's something that organisations need to do repeatedly. And then finally, just in terms of things to take away for leaders, given the audience here, a few things that came out of the guide for me. First of all, being brave, transparent, being open about the issues that you have within an organisation, absolutely crucial. The use of evidence, making sure that your decisions are based on the evidence you have. Being open to criticism. And then finally, considering external providers, external people to come in and suggest ways forward for your organisation. So I hope that the guide is something that you find that's useful and this discussion that we're going to have today. And I think that's probably my 10 minutes. I'm looking at Saffron.
Yeah, well, you've got a little bit of leeway, but...
That's fine, I'm relaxed now. I've done all I need to say. More time for Q&A.
Yes,
it will buy us a little bit of time. Okay,
Janine, I'm going to hand over to you now.
Yes, so considering that I'm here to talk about disciplinaries, I'm not going to do that much talking about disciplinaries because from my perspective, they're very much a symptom of the broader organisation culture. And I'm very keen in our conversation today that we can start to progress beyond us looking at that specific. So the RES has been amazing for getting this to the table and for giving us a common language and a common metric. But I think we need to move to the place where we're actually recognising that it's part of the broader employee experience. My place on this panel is to talk about the practical things that we're doing and start to generate some ideas that you can take away in addition to the context that Andrew's given. But before I do that, I wanted to take you back to the London Workforce Race Strategy that we published in October 2020, and that was the role I was doing before I moved into the BHRUT CPO role. And that began, and the front cover has a vision statement, and I'm going to read that out because thinking about the culture goal. There should be more senior decision makers who look like me, who make choices that don't disadvantage me and my future. The leaders who don't look like me would be understanding, authentic, and committed to inclusion through their actions and how they speak. My difference would be valued. It would be a buzzing place to work. Everyone would feel uplifted and part of a shared vision to deliver high-quality patient care. And so you can imagine in an environment like that, which doesn't explicitly talk about race, you're not going to be in a position where the circumstances that lead to disciplinaries are popping up as often. So I think there's something about how do we hold that as a vision. And that race strategy called on, so the first action in that strategy, the first recommendation was to modernise HR processes. And part of why I made the move from that role in London region to what I do now is because BHRUT has afforded a real opportunity to be part of an anchor organisation to realise that vision for our people. So we employ about 8,500 staff. 66% of them live in the 3 boroughs that we serve. I don't know if any of you are familiar with Barking and Dagenham, Havering or Redbridge, but between them they represent the boroughs with some of the highest levels of socioeconomic deprivation, highest percentage of childhood obesity, lowest levels of education attainment. Yeah, so if we think about our staff and how they arrive at work and how they then leave, there's something about our duty of care there. We're really going to take up that anchor piece. And also, I'm sitting here as CPO of an organisation that in the brochure you will see, we are one of those high-profile ETs that were lost on the grounds of race discrimination. And so it's going to sound weird for me to say, but I'm lucky because I've landed just as that ET result came out, and that has given us even more of a mandate to make deep and structural transformation. So what does that mean? What does that look like in terms of our practical things? So my role, previously there was a separate director of EDI and a separate workforce director. All of those things have come under my responsibility. I'm also responsible for training and education and employee relations, and essentially a lot of the levers that cover the employee experience. That means that we're in a position where we've got someone who has board level accountability for how it feels to work and be part of the team at BHRUT. Yeah, and so I'm able to be asking those questions and keeping it on the agenda. The ET also gave us a really clear set of recommendations. So it called out things like, are we checking our biases? You know, is the standard of proof the same if I were to raise a complaint as if my white counterpart were to raise a complaint? You know, are we believing people when they're sharing, this is my experience? But then also, are we challenging people where their bias may be leading to the issues? So I'm not going to break any confidences here, but thinking about the broader context, we often hear stories about 2 members of staff who arrive late for work. One member of staff, let's say her name's Jane, is friends with the ward sister, and so the ward sister is able to say, Jane, you were late today, what's going on? And Jane can explain, you know what, my husband's working a different shift, I'm struggling to get the kids dropped off on time, and then you can make adjustments. Then you've got another member of staff, let's call her Fumi. Fumi also arrives late. She isn't friends with the ward sister. Ward sister just makes a note, Fumi has arrived late. And then because she's facing the same circumstance as Jane in terms of struggling with childcare, she continues to arrive late fairly often. And what then ends up happening is that Fumi is then subject to a formal disciplinary once the manager has developed enough data. Yeah? So how are we challenging that? Where are we checking that in our systems? And so the way that we're addressing that in BHRUT is that we're starting with recruitment. So how are we recruiting those senior leaders, those middle managers? And so we've completely changed our job descriptions. And so I expect to see our data continue to improve, because this is all live stuff we're doing. And our JDs now centre just as heavily on how people do the work as much as what they do and their technical skill. We have EDI partners who are involved in every senior recruitment, and we've set a bar in terms of leadership behaviours. And that's meant that we've done some quite bold and scary things. At one point, when we established our 5 new clinical groups, 3 of the 5 clinical director roles were left vacant because the people who went for the interview didn't hit the bar. So there were some scary times as we did this. And just conscious, I'm okay for time, I think I'm 7 minutes in, okay. And then when people are coming into the organisation, as well as having it clear in your JDs, we've introduced something over the last 3 months, again I'm expecting the data to continue to improve, called our new corporate welcome. And part of that corporate welcome, which forms the very first day that new people will start with our organisation, we're introducing something called the manager's licence. So before I let you loose managing our people, I want to know that you are aware of our basic expected standard. And so the first stage of the manager's licence includes things like, how do you find our policies and apply them fairly and consistently? How do you have the conversations that make a difference? So in that Jane and Fumi example, you feel just as confident going and having that conversation with Fumi as you do with the person who's your friend. Other things that we're doing and which we talk about in the booklet are things like Freedom to Speak Up. We have had, since the very beginning, an independent Freedom to Speak Up Guardian service. I think we were actually involved in forming it. And they're a really important guide for us. I refer to Paul as my canary in the mine. If people are talking to Paul, that means I need to be directing some of my OD resource to those areas because there'll be something more going on. Yeah? Just in learning culture, so can we talk it through? We've also reviewed and updated our dignity at work policy, making it really clear how you'd go about tackling things informally first. I've also grown and invested in our ER team as well. So really strong head of employee relations who was actually previously a HR director. So really strong and knowledgeable individual who's really committed to this vision and is committed to running just learning and also rapid resolution through the way that we address things. We've also invested in a separate team that reports directly into the CMO to work on doctor cases, to work on MHPS cases. So again, thinking about all of those behaviours. And as part of that work, we've commissioned some work with the GMC around doctor behaviour training. Yeah, recognising that for many of our staff, the senior leaders that they interact with the most are the consultants in theatre. Yeah, so how are we supporting them around their behaviours? The other thing that I do, we've talked about this, Andrew and I, and I'm happy to talk about it a bit more, is I'm standing in the way of suspensions. Because I recognise that suspensions, although as a trust we might reassure ourselves that it's a neutral act, it's never actually a neutral act for the person on the receiving end. But really the main thing is, and I've talked a bit about investment, but that's also paying off. So this work that we've been doing, and I recognise we're on a journey, yeah, we are definitely still on a journey, is starting to pay dividends in that I was able to fill those 3 vacancies with really fantastic people. And we've got some of my team here in the audience, they were telling me about in radiology, whereas previously we'd have struggled to fill roles, we're now having to turn people away who are interested. Our vacancy rate has fallen significantly. It's going to be about 10% by the end of the year. Our attrition rate has also fallen by 3% over the year. So there's a lot more to this culture work than merely looking at closing the disciplinary gap.
Thank you so much. Really, I think just really great insights there and really great framework, Andrew. I've just got one question before we throw it open, and I think it kind of builds on that standing in the way of suspensions piece, which is, you know, we are now in an environment which when we've discussed it before, we talked about it as being an enhanced regulatory environment, i.e. post-Let-Be, things like Martha's Rule, where the focus is really explicitly on quality and safety. And there might be this sense of kind of moving very quickly to some quite specific big steps. What's the impact of that on trying to kind of think about how we reduce that gap, that discriminatory gap in that context? Because I think, in a sense, those 2 elements don't need to collide, but you could see how, if they weren't carefully considered and interpreted, they could. So I'll go to you first, Janine. Sorry, You've been talking a lot, but I'm going to make you talk some more, and then I'll go to Andrew.
So in the post-Let-Be environment with increased focus on regulation, I'm worried. I am worried because there's something about how do we, because I don't accept that just in learning culture and thinking about how you create safe environments for all of your staff to speak up and share their concerns, but not necessarily resulting in people being penalised. I don't accept that actually should lead to patients being less safe. Yeah. But the regulatory reaction is saying that actually that by not coming down like a ton of bricks and suspending everybody, you are making patients less safe. So there's a tension there that we need to call out, and I'm nervous about that because I worry that we'll be back to the examples that we've talked about and that RET talks about, which is that we have a different level of tolerance for different behaviours across different demographic groups. And I worry that the fallback to the regulatory environment will mean that some of our staff will suffer more than others, and it may not necessarily lead to increased safety.
Yeah, I mean, I think that pressure's always been there, and in the light of Let-Be and other cases, it's inevitable that pressure is going to increase. So it used to be a knee-jerk reaction that you would suspend, and then there was a whole line of cases that said, actually, that isn't what you should do. And trusts have been criticised for all sorts of over-dramatic reactions to things. There's a case involving nurses, for example, where safeguarding were very clearly pushing for suspensions, and the EAT found they were completely disproportionate to the risk. And that's what it comes back down to. If there is a clear present patient safety risk or a clear risk to other staff, the justification is there. But if it's not there, then you are going to get into difficulty. It's not just in relation to the disciplinary gap, but generally because it isn't a neutral act, as Janine says. There's a case called Maze where the Court of Appeal say exactly that. It's not a neutral act. Most of your policies will still say that, but it's not a neutral act. If I went home this evening and said to my wife I've been suspended, she's not going to say, well, that's fine, because that's a neutral act. It doesn't mean anything. Inevitably, she's going to think, well, what the hell were you doing? So there is clearly some criticism attached to suspension. So what we say is, look, find the justification. If you're concerned about interference with an investigation, if you're concerned about patient safety or some safety issue with other employees, consider suspension, but ultimately look for alternatives. And the number of cases we've had where there is perfectly reasonable alternative available to an employer but they don't take it are legion. So you're going to have to push back. There is going to be that dynamic. I think from an HR point of view, from an organisation's point of view, you're going to have to push back in some cases against the natural reaction to get them out of the organisation because you're concerned about patient safety. But I think the dynamic's changed, but it's always been there. It's always been there.
Thank you. Okay, I'm going to open it up to questions now.
So please do ask away. I'm going to go to Alex and then I'm going to go to Steve. Same trust, probably asking the same question. Okay. Please, can you say who you are and where you're from?
So I'm Alex Whitfield. I'm Chief Exec at Hampshire Hospitals. This is really interesting. And so my question is, we have a lot of ethnic minority colleagues who are internationally educated, recruited from overseas. We have a lot who are born and brought up and educated in Britain. And I don't know if are there any different interventions to tackle the disciplinary gap with those different populations? And I guess I'm thinking of two things. So I'm thinking, I know some of our nursing colleagues that have trained overseas have learned different protocols and methodologies that if we don't understand and talk to them about it, could end up people thinking that they're not competent or whatever. And we've also got a lot of Nepalese colleagues who work in our domestic team who don't necessarily have as good written English, and we don't need them to, and therefore may not fully, we may not have fully explained our policies in a way that they can then. So it's just, is there something different that we need to be doing for people who have grown up in other countries and come to this country to look after our population, and I'm always so grateful they do it, that's different from people who were born and brought up in the UK?
Thank you, Alex. I'm going to go to you first, Janine, and then to you.
Yeah. So in my trust, we have something called the nurse intern team, and they are senior nurses who are dedicated full-time to supporting staff who have been internationally educated and recruited. And so they would part of the onboarding process. So we recruit very heavily from overseas for our nursing workforce, as I'm sure lots of us do. And so the very first contact that those individuals have when they come to us is with the nurse intern team, who help to settle them in, help to acclimatise them to the expectations and working and living in Romford. And that's really important. And we've agreed that the manager's licence corporate welcome is a new thing that we've started. And we've agreed that I think we're expecting 125 newly recruited nurses from India to start over the next few months. And we've agreed that they will go through the normal onboarding and acclimatisation programme and then join the corporate welcome with the rest of their peers. So they'll then get the same information as everybody else.
Thank you. Andrew, anything?
I'd just add, the only thing I'd add is I think that's right. I think the focus should be on, of course, supporting. But the other thing is, I think if you have some of these interventions will cover some of those types of issues. So, for example, the gateway idea, the idea that before you even get to the start of a disciplinary procedure, you have some degree of consideration of cultural issues, whether there are other factors at play. And I would hope that if you've got that kind of system in place, which I'm a big supporter of, because I think it makes perfect sense. If you've got that kind of system in place, though, exactly those sorts of issues hopefully will get picked up before you even start a process, and then you make some allowance and consideration of that before you begin. But in terms of the discussions we had as part of the guide, there weren't any specific interventions to deal with that point. Yeah.
Thank you. I'm going to go to Steve and then I'll come to Jag.
Thanks. Would like to learn a bit more about that. Because the NHS is expert, isn't it, in putting people into leadership roles and not training them how to do the job. So you're a good technician, you must be a good manager. It doesn't work, does it? And I think the culture of organisations is a determining factor, a large determining factor in a lot of what you've talked about. So I'd be interested a bit more about that. The guide also contains lots of lessons for boards. And I wonder from each of you if you've got one in particular that you think makes the biggest difference for organisations.
Fab. Thank you, Steve. Andrew, what lessons for boards? Your one lesson.
Yeah, my one lesson. Well, I mentioned a few. I think the biggest lesson is accountability and making sure that there is a proper discussion at board, because very often these things are filtered down. I think the leadership starts at the top. So one thing is to be interested in the topic and make sure that there is a proper monitoring going on. That would be my one thing. Yeah.
Thank you. And do you want to say a bit more about the manager's licence, Janine, and then your one lesson?
Okay. So the manager's licence, I'm immensely proud of it, and it's taken. I'm fighting resistance now from clinical groups who are like, but what do you mean I have to wait 2 weeks before my new starter can start? Because part of it is that we've got 2 fixed start dates now into the organisation. So that means that people are joining as a cohort of peers. So they have inbuilt support to go through this process of joining a new organisation. The plan is that over a period of about 16 months, you'll go from being a new manager in the organisation to having completed the advanced manager's licence stage, and the foundation will be mandatory, but the other stages you can opt into. And the level of depth and complexity that you'll be exposed to in terms of leadership and management will increase. I'm very lucky in that my training and education team are an accredited training provider, and so we're able to develop and deliver the training in-house. We do buy in one aspect though, which is active bystander training, and everybody going through corporate welcome, manager or not, is exposed to the active bystander training. So they all know how to step in when they see wrongdoing.
Right. And your one lesson?
What did I say in the book? Yeah, I said resist the temptation to be the hero leader. It's about collaboration. Yeah, so for me, the big part of the culture changes that I've done, not just in the NHS, but more generally, has been that I don't know what the problems are. I'm sat where I sit, looking at things through my lens, but being able to talk with your staff and understand, okay, so what is the problem that most bothers you? What is it that's making you think about leaving? And it'll be different for different organisations.
Thank you. Okay, I'm going to go to Jag, then the gentleman behind Jag, and then gentleman in front.
Jag Tarsing, Chair of Coventry Warwick Partnership Trust, but really passionate about this particular area, worked with Saffron on this, so the report is welcomed. I'm just going to do a little bit of a plug for something you asked me to do, Saffron, 6 months ago, which was, what is the one big idea you've got? And the one big idea I put on that podcast was data. Look at the data. The data tells you where the disparities are. Focus on the data and reduce the disparities, whether that be race, whether it be health inequalities, whatever it is. So I advise you to look at that. My own experience in this mirrors a lot of the stuff in this report. When I first got appointed as chair, my first question was, I do not want to be the first bank chair taken to employment tribunal because of disparities in my data. Are there any disparities in discipline? The answer came back, we've looked at all the disciplines and everybody deserved to be disciplined. I said, that wasn't the question. Go back and answer the question. Is there difference in black and white? And there was. Then we found out about the RCN program, and I'll give you a bit of, and this is the one thing that's missing out of the report, so we can add to it. And that is the financial benefit. So when you look at the RCN,
Jag, can you speak into your microphone?
Oh yeah. When you look at the Birmingham Solihull example of the RCN, £2.1 million from reducing the number of disciplines. So when we brought that into my trust, my head of people said, no, we need to deliver it quicker. That program takes too long. So we invested in 3 investigators. Our numbers of disciplines have fallen through the floor, and numbers of suspensions. And then Janine gives us more, and that's cashable. You can measure the money. Then Janine gives us more, which is retention rates, vacancy rates. And this is the theme for me over this conference so far, where we all get the moral case. We need to be able to make the case out the financial benefits, whether it's to us, to the community, somewhere else. So I think this report, turn it into a one-pager. What was the problem? What were the outcomes you're recommending? And what are the things we can measure on a dashboard? It would be brilliant. I'd take it to my board tomorrow. And I'm looking for the apps that I've got within something that Andrew said. So thank you very much. No question.
Thanks, Jag. Yeah.
Okay, thank you. Chief Executive for... yeah, so thank accountability when it comes to people reporting racism. We see from our data, about data, investigated or
Thank you. So what needs to be done differently? Sorry, we had a few sound issues there. What needs to be done differently to ensure that people are held to account when these things are reported?
Yeah, and I think it's a really good point. From an employment lawyer's perspective, given that I represent trusts, I think there is sometimes a difficult dynamic because, and you see it in some of the cases we've seen reported recently. The Cox case is a good example, where there's enough there for the trust to conclude, or the organisation to conclude, that there has been discrimination. The difficult dynamic, and this is where it comes to being brave, is an organisation standing up and saying, yes, actually, we have found that there was discrimination. And the reason I talk about being brave is because, of course, the minute you do that, you are opening yourself up to an employment tribunal claim, because you're admitting internally there's been discrimination. And so you have to, as an organisation, bite the bullet and say we are going to be brave, and where we find it, where we investigate it, where we take it seriously, and we find discrimination, we will call it for what it is, and we'll reach that view. In terms of whether you take it seriously and whether you investigate, from my point of view, it's easy. You always investigate these kind of concerns, because otherwise, as an organisation, you're putting yourself in a very difficult position. There is the patient safety aspect, but of course, on top of that, there's all the things that Jag was talking about, the reputational aspects, the financial aspects, if you don't do it. So, yeah, the answer is you should be investigating it, and then you should make people hold the people to account. But that is brave. I think we have to acknowledge that for an organisation to do that, there is an element of bravery, because they are automatically creating, potentially, a tribunal claim that they've got no defence to. So from a lawyer's point of view, I'd be saying, well, look, you've got to do that because it's the right thing to do, but there are consequences. But it is about being brave, I think.
Yeah. I think if I come in, so I've got a slightly, it was terrible for the individuals involved, the ET, but what that meant was I was able to stand up in my first month in the organisation, or first few months in the organisation, and say, I have a document here that, on reading it, has led me to believe that we are institutionally racist. And so for some of our senior leaders, that was their first contact with me. But it meant that I could lean in and be brave and be bold without some of that jeopardy, because a judge had said it.
Yeah.
Yeah. So There's something about how do we, make a silk purse out of whatever the saying is. So it's how do we lean into and make sure that we are acting on those challenges.
Yeah.
Thank you. Really important point.
I'll go to you, Roger.
Thank very much for the insights. So the trust I work in, I'm told 50% of our Band 5 nurses are from the global majority, and the exec team and the direct line report to the exec team has 0 from the global majority. So, the vision that you described, Janine, is, whilst I completely agree with it, is with some distance from that. Listening events we're having with BAME staff, reverse mentoring events, etc. They're surfacing all the things you would expect and things that we read about. And just a different angle on this for me is about cultural awareness programs. And so, for example, I was reverse mentored by a lovely woman from China who was describing how, from her culture, standing up to authority is impossible. The deferential nature of her cultural programming is that she would never and could never speak up in the way in which people from different cultures could. And the reason that I raise that is because that's very, very useful insight to me. And of course it meant that there are other things you can do to make people feel safe, but you have to take action rather than just expect someone's going to be safe to speak up. If you just know that tiny insight. Other insights about people who won't look at someone in authority in the eye because that is seen to be disrespectful from the culture that they have. But of course, some people might think it's disrespectful not to be looked at in the eye, and you get that cultural difference or difficulty. So my question is there any good practice about actually how to educate people? And it feels like it might be a naive question, so forgive me, but how people who are in the ruling classes, in the leadership roles, who are not from the global majority, should actually gain the sort of insight they need to about the cultural differences that actually could lead to misunderstandings and difficulties, or is that just naive thinking? I'm just troubled by that.
Thank you, Peter.
Do you want me to take that?
Janine.
So I think there's a couple. So I've since post George Floyd, I no longer collect stories. I invite people round the table to help co-design. And so for you, I would suggest that I'm happy to talk with you separately about this. We've got something now called the Shadow Exec, which is a separate shadow executive body made up of a representative sampling of our staff across all characteristics, so band, role, ethnic origin, sexual orientation, sex, age. So designed to be representative, and they see all of our papers before they go to the Trust Exec Committee. And me and Matthew, my CEO, we sit and we meet with them and we go through their feedback. And they're able to directly feedback to us, and it then gets played back into the board what they've had to say. And it's been phenomenal. The insights that they bring and the lens that they bring has been so valuable. So I'd suggest perhaps something like that, so we get people around the table and give a space for their feedback. And the Shadow Exec have really lent into it. They're giving their time, so we've had time away from their jobs, and that we've got their managers' agreements, but they give their time and they really lean into the idea of actually shaping the organisation. And that's been so empowering, and it's been wonderful to then have advocates going through the organisation about our intent as well. So it's a two-way. It's been amazing.
Thank you. I'm not going to come to you.
No, I can't better that. That was a great, great answer.
Because we're running up to time, so I'm going to go to Roger as our last question or comment.
I think there's...
Do you want to say who you are, Roger?
Sorry, Roger Klein, Middlesex University. I think we're at risk of understating the challenges around raising issues of race. If you look at what the tribunals, I've just looked at the sort of landmark tribunals around this, and we've got a report coming out in the new year. What they talk about is, first of all, denial is very common. People find it really hard to accept that there's racism. So in the Cox case, for example, the appeal accepted she'd be badly treated, but decided it wasn't race discrimination. In the Cox case, NHS England's defence was basically, well, there was no evidence of motivation around race. Anybody with an O-level in employment law would know that was nonsense as a defence. What made it worse was I drafted for Michelle an appendix to her appeal, which pointed out what the law was, and it's still the HR senior advisor said there wasn't racism. We talked about if there's a pattern of detriment for which there's no credible explanation, you can start to draw some inferences, which is what the tribunal says. So I think there's still a real issue. I've spoken to probably 150 groups of HR directors and chief people officers, and there's been very little lessons learned from what has happened. A lot of goodwill, a lot of people willing to learn, but for example, most of the audiences I ask, have you read the text of the tribunal decision? 42 pages, really good summary of the law. Less than a quarter have read the decision. These are chief people officers. So I think we need to, there's a lot of good stuff said, but we shouldn't underestimate the resistance and the challenges around this area. And I think what you've written is a helpful start, but there's a lot more stuff to it. Just as a final point, speaking up about race is really not the solution. The solution is hearing it and being proactive and being curious and problem sensing, rather than expecting people always to be the people who raise the concerns.
Thank you, Roger, and salutary words to end on. I'm going to ask for your reactions to Roger's comment before I round off today's session. Andrew, and then I go to Janine.
Well, yeah, I mean, clearly that's right in terms of the way the tribunal processes things, and clearly it's right in terms of the take-up. I mean, we've done a fair number of sessions for board. One would hope that they would read the judgment and they would take the lessons away from that, and all we can do is encourage them to do that.
Thank you, Andrew. Janine.
I think, so I know this isn't Chatham House, but this stuff is hard. So I've been, I'm not breaking any confidences here, but I've been dealing with a case where disciplinary was brought. I think, or I thought that there was an undertone of bias and intercultural tensions in it. And I tried really hard to commission an independent investigator with some expertise in this space. And I'm not encouraging any of you to go out and start your own businesses, but it was really difficult to find solid investigators who have a good grounding in intercultural awareness and confidence in talking about racism. So much so that when I got the first draft, I went back to them and I was like, you say, we think there may be some cultural issues here. I'm like, do you mean racism? Maybe. And being CPO, I have to be independent to the investigator. And so when the final version said there are some intercultural things that need to be talked about, but fell short of calling out racism, you know, as Roger has rightfully identified it probably should, I had to let it stand because I'm not allowed to take the pen. And we're going to see how that plays out. So I think the issue is that we, you know, to your point and the challenge about us as CPOs having good intent, there's something about you can have the best intent in the world, but then if you don't have the tools to enable you to deliver the change, it's then even harder. So I don't know how we go forward, really, other than being encouraged that we are calling it out and recognising that we do need to go forward.
Thank
Sorry,
you.
somebody depressed now,
No. We're going to lift the tone because I think Roger's word's absolutely right and the challenge is absolutely right. But I think also let's remember we've had a conversation today which is about some really practical steps that people can take. We've talked about, you know, how we actually have measures in place to really get managers competent, the managers licensed. We've, you know, Jag rightly talked to us about data and the importance of data. We've had some really good examples, and what we wanted was those practical examples, and we, you know, that has come out today. I think the theme that ran through for me today as well was we talked a lot about the word mandate, and we talked a lot about the word accountability, and I think we have to get to that place where you have everyone has permission to do this, because that is the really, really important element. So I want to thank you, Andrew, and thank you, Janine, for your contributions, and everyone for asking the questions and the conversation. I think it's been a really great discussion. Thank you very much.
Great, thank you.
Thank you.